like a doctor visit, blood work, whatever, you pay cash for. And we have things like health savings account. Like my company has a high deductible plan, but we have a health savings account. Those things are great. I invest money into it. I grow it. It all grows tax free, and the government doesn't get any of their hands on it. And for stuff like that, that is how you can get healthcare to be cheaper. Like there's a lot of places that they only accept cash. They're much cheaper than everywhere else.
I'm not going to disagree with you, Nick. As a matter of fact, I see your point of view really clear. I have medical insurance and it pays for my stuff, and that's what people want. But, I just had surgery, and you take a look at the bills. Somebody who just stepped in the operating room for like 3 seconds, $10,000 for him, or it's just like really ridiculous that when you have insurance, they just throw in the kitchen sink. You're right. Everything is inflated. There has to be another way. I don't know how you change the whole system right now, but I see your point of view. Definitely see your point of view. And you go ahead. You want to say something?
There is a way to change it. Like, I hate to say I don't like Obama. I didn't like the healthcare, but what he said, one of his messages was actually right, where he said in his bill it shouldn't be more than 8% of your pay, which 8 or 9%, something like that. I'm like, I'm okay with that. However, the problem is that before tax or after tax. And the other issue is, like, you get healthcare plans. Like, my company gives good benefits. So you pay whatever, let's say $100, $200 a month to cover a family of four, $2,000-$3,000 deductible, right? And you make $60,000 a year. You pay $200, $2,400 a year. Okay, whatever. Look at what percentage it is of their income someone makes $60,000. Now, a bigwig executive that makes $300,000-$400,000 a year pays the same $2,400 a year for health insurance that the person that pays $60,000. So, like, right now with Medicare is you pay 1.45% of withholding, and your employer pays a 1.45% on their end. So you're already paying in about 3%. Okay, and if Obama would say, okay, 9%, 8-9% to cover yourself, if you just told employers, hey, to insure each employee, it's going to cost you like 4 or 5% of their wages, and then you as an employee to always be covered pay like 3-4%. Do you know how many people would sign up for that? But that's not, like, how our system's set up is just so screwy.
And let me ask you a question, Nick. Do you believe from each according to their needs, to each according to their ability?
Ouch.
Just out of curiosity, do you agree with that statement?
What do you mean by that?
It's very simple. From each according to their abilities, to each according to their needs. Like, that's what you're explaining here.
Yep.
That's what I heard too. The communist
so
way of
you're
doing
a communist, right, Nick?
Well, I'm not a communist. I bet you more
that is literally communism, what you're explaining.
That's not communism.
That is definitely 100% communism,
go read my profile. Go read my profile, bro.
What you're explaining is a Marxist idea. I'm just being straight with you.
No, it's not a Marxist idea. It's a free market.
No, it's not.
No, that's not.
It's not free
No,
market.
it is. You buy your insurance the same way you buy your car insurance. Trump's a fucking communist too. Trump's not a conservative.
No,
You think
we
Trump's a
don't pay
conservative?
car insurance based off of our income.
Well, you do pay it based on the car you own. And
Stick
healthcare
on
not
health insurance.
That's
healthcare's not the same as
No, you don't.
car
So the risk
insurance.
doesn't change.
Record.
No,
The risk
no,
doesn't
but
change if I make $1 million compared to if I made $100,000. The risk doesn't change. It's still the human's health
Right.
based on their age.
Your car insurance rates also depend on a lot of different factors, not just the type of car you have, but
Your accidents,
the area, your driving record, the area you live in, all types of shit.
So Nick, it's an awful idea. I mean, it's an awful idea. But the better solution would be taking out the middleman, and allowing hospitals and doctors to be able to offer membership
I
programs.
already gave a solution. Where you pay cash for the basic stuff.
I don't think that, hold on, sorry.
I can already pay for the basics. So we already do. We have that option. So look, the idea would be let me just, I do that. I don't have health insurance. I pay cash. So look, and I've done it for 15 years. Ever since Obamacare came in place, I got rid of healthcare. So let me explain though. The way to do it is take out the middleman and allow hospitals and doctors to offer membership programs rather than having a company called an insurance company have to pay my bills. Now we can still keep private insurance, allow for group programs and stuff like that, but you can make co-ops between hospitals and doctors from region to region and group to group areas where I could be able to get service if I was in another location. But generally speaking, we don't have to have a middleman that pays the bills. I could buy this same membership program, like a gym membership program, from my local hospital or my local doctor, and that would at least cover me, 85% of the time that I'm,
What do you do with Medicare or Medicaid?
Cancel it.
No, so Nick, because I need to say something. So I work in Medicare, and I don't think you understand what it was like before Medicare. The high deductibles, they don't have coverage for pre-existing conditions. So Medicare was created for seniors. Hold on, Nick, if you give me just a Medicare was created for seniors specifically because they were being denied coverage, they were being denied surgery, they were being denied certain treatments because they didn't have coverage for a pre-existing condition. That's what it was like before Medicare. It was very hard for seniors to get that coverage. So Medicare allowed that. In Medicare, you can also get Medicaid if you are low income. So you can get a dual plan, whether it's you got a healthcare dual, WellCare dual, Alignment Heart and Health Plan has a dual plan. So it allows seniors who haven't put in that work that you are suggesting for them to get an employer plan. They haven't put in that time that Medicare has that you are supposed to work to get Social Security or whatever the case may be. So there are times where people are disabled that cannot qualify for certain coverages because they haven't put in those hours that Social Security and Medicare force you to have for you to get signed up. So I think Medicare is very, very important. Our senior population is completely just forgotten about. Their age is blamed on their sicknesses, their illnesses. So Medicare is very important for our senior population. We just keep forgetting it.
No, but if you pull everyone together, the problem is with Medicare is everyone high risk goes into it. If you go read Ron Paul's book, he never took any insurance, and insurance bills or hospital bills started going up since they implemented Medicare. Anytime the government gets involved, the cost goes up and the quality goes down.
Let me ask you, after the deductible is paid, how much do people put into their hospital bills with Medicare? Do you know the percentage?
I have no clue.
Okay, so there's a deductible when people get onto a health insurance. You have a deductible. Usually it's like $1,200 to $2,000. Once you pay that deductible off, so say you're going to an office and you get blood work done, or you're just getting your checkup, or you're getting an ECG done, or EKG, I'm sorry. You would pay off that deductible. After you've paid off that deductible, you are responsible for 20% of the bills, while your insurance covers 80% of the bills. That's why it's important, because the deductibles before Medicare were like $10,000 to $15,000 to where they couldn't even afford their bills. And Medicare, it allows you to have just a percentage that you pay, 20% and 80%. That's important. So they're not paying that much anymore than they were without Medicare.
Look, Medicare is bankrupt. We can't afford it. I'm telling you, like the unfunded liabilities. Look at the price of gold as of recently. Like, I'll say one thing about this stock market and Trump. He's been very good to me financially. I love him, and I love Biden. Like, both of them have. They've made me a very rich man. But I could capitalize on the stupidity of these politicians. But I'm just saying, look at how the unfunded liabilities of Medicare. It's not sustainable. It's just not. It's a Ponzi scheme, and everyone that's high risk goes on it. And I do agree with Joe. We probably should be paying cash for the basic services, but if we did it that way, it would be cheaper. Just go YouTube Oklahoma's surgery center. It's just a surgery place where he only accepts cash, and they were showing a local hospital. A guy had to get carpal tunnel, or a lady had to get carpal tunnel surgery. It was $28,000. This guy did it for $3,000, and she told her employer, and her employer actually, because they were a self-insured plan, her employer paid for the like procedure because she's like, it's that cheap.
Yeah, so the
Well,
reason.
yeah, that's an employer plan.
Oh, sorry, Hawkins.
no,
The reason is I just wanted to add this. The reason it's cheaper to pay cash to a doctor or a hospital, well, it's to private practice doctors. Let's be clear about that. Hospitals don't get that much cheaper when you go to the hospital with cash. But the reason why is they don't have to deal with the paperwork for the insurance companies. Oftentimes, while you're sitting there waiting, because a cash customer gets right in and right out immediately. But while you're sitting there waiting for those 2-3 hours in the lobby and in the waiting room, a lot of times they're just on the phone line trying to get approval from your insurance company if they're going to pay for it or not ahead of time. So insurance has definitely created a false inflation in health, but it's not just health. It occurs in everything insurance touches. And we have a larger problem with insurance, greater than just health insurance, that I think we'll have to come to addressing one day. And most of it is just they need to pay their damn bill.
I just want to answer a question to James in the chat. There is an age limit for Medicare. It's 65 and over, or unless you've had a disability for over 2 years and you've been getting Social Security checks from, or SSDI. So yeah, there is an age limit for Medicare, and specifically for seniors, there are people who aren't safe.
But the thing is, too, is like Social Security, too, is the biggest Ponzi scheme ever. Like, like Japan's having that problem right now. It works when you have more people paying in than drawing out. But when the pyramid now goes to baby boomers, when you have more people drawing in than out, I mean, that's going to be depleted in like 12 years. I'm not even depending on it, but to me, I don't need it. But I think they're eventually just going to means-based test people, and it's just going to be like a welfare-type program.
Nick, I agree with you about the Medicare is failing, but like I said, the solution isn't as easy as you said, especially not a communist plan. It's just that you just can't. It's not going to change over. It's whatever it was. You can't change it overnight. And you're right. It's going bankrupt. I don't know, because our politicians sold us a bill of goods, and that's what happens. That's big trouble.
Switzerland doesn't.
It's
Switzerland doesn't have.
I never hear people criticizing the.
Switzerland has like the longest life expectancy. Same with Singapore, and everyone gets healthcare. It's not government run.
Hold on for a second, man. Why? How come I never heard people on the left criticize Obamacare or Obama when he made it a provision that if you didn't have insurance by the time that you filed your taxes, your ass was penalized for that shit. They were forcing people to get that crappy ass goddamn coverage.
Yeah, that is stupid.
We're not even talking about the deductibles, the highest deductibles, right? Think about it. People who didn't have a job, people who were unemployed, people who were low income could qualify for Obamacare. But if they used it, then they had a high-ass unreasonable deductible that was too high for them to fucking pay. It was a trap from the word go.
Yep.
Then if your ass didn't have it, by the time you filed taxes, your ass got penalized for it. It was a tax. How come people on the left never criticized Obama for it?
Oh yeah, they're idiots like that. That guy Aram, he thinks that was the greatest thing ever because more people were insured. Well, yeah, when you put a gun to people's head, I mean, but there's a loophole a lot of people don't know on the Obamacare bill. It's called the millionaires loophole. So what you can do is, like, let's say you're 60, 61, wanting to retire and can't get Medicare till you're 65. if you have a Roth IRA, take as much money as you can out of it for like 3-4 years, or live off of it for 3-4 years, and show very little income. Like you can show like maybe $12,000 a year. You can get every government subsidy out there. Because I know a guy that's worth like, I don't know, like $4.5 million. And I told him, he's like, well, I don't know if I can retire because of health insurance. Like, no. I go, show nothing. And this guy qualifies for food stamps. He qualifies for Medicaid. He only pays like $50 a month for health insurance, or $100 a month for health insurance for he and his wife, because of this Obamacare millionaires loophole. Because the Obamacare bill bases your insurance on your income, so he only shows like $20,000 a year, and very, very few people know about this loophole. But I know a good tax.
Yeah, the whole world knows about the loophole. The whole world's collecting from the government, food stamps. People, everybody knows about all the loopholes. That's why we're going bankrupt. Everybody's collecting. No, please. Everybody knows about those loopholes.
Then how come like very few people understand how like corporations can pay no income tax? I come on this app and people are clueless.
I think everybody who's gone to business school understands that, and if you don't understand,
you want to know freedom, but then fuck you in the
post-secondary education.
Go back to your fucking
People who don't go through the American school system. This is extremely basic.
Go back to your fucking communist country, okay?
The fact that you think this is like
time for you to get another COVID vaccine. We know. Yeah, we know that you're here to troll and add no value to any room.
I mean, I'm literally saying what Jules is saying, so I guess Jules is here to troll too then.
I'm not a communist. If you are, you know.
He is. That's the problem. He lives in like the People's Republic of Canada, and he tries to criticize American politics. And then he's very fucking stupid.
Sure.
He said that like he hopes Canada's going to sell all their stock in the U.S. market, and then they're going to send our stock market tanking. Which is, and if he had any brains, it's illegal to do. So yeah.
It's illegal.
Remember,
under what? International trade law? The thing that Trump shits on all day long? Doesn't even
you can't. If you own stock in, like, if you're heavily invested in a country, you can't just sell it off. Just like Warren Buffett can't sell off all stock in Berkshire Hathaway.
But you said it's illegal. You mean they shouldn't?
It is.
Illegal, but which law?
It's illegal.
Talking about?
Yeah.
Okay, let me fact check it. I don't believe that that's illegal.
Yes, it is. Go read it in their fucking 10K. If you don't know anything about SEC reporting and Securities and Exchange, which you don't, because I've worked in that area, you can't just sell off all your stock. Bezos can't sell off all his stock in Amazon. You know what that would do to the stock price?
But wait,
There's laws
those
against
laws apply to Canadian government-owned U.S. bonds?
Yes.
No, it doesn't. No, we're in Canada.
I said
So we don't care about your stock laws.
You don't care about your shit.
These aren't bonds. They're not even
We can take
stocks.
over your country.
You don't even know what you're talking about. You don't know the difference between bond and stock. We're talking about stocks. Nobody ever mentioned stocks.
Stocks.
Yeah, but we're not talking
Yes,
about
I do.
stocks in this case. It's not stocks, it's bonds.
Yeah, folks, can I?
But I was talking about stock.
Okay, but Canada doesn't own American stocks. The threat is not the
They're
bonds.
heavily invested.
Okay, but you don't even understand the threat then. The threat is not that Canada is going to sell off American stocks. It's that the Canadian government and the Japanese government are going to sell off American bonds. That's not illegal, Nick. And it's not illegal to sell off American stocks if you're not American. I don't know where you're getting this information. It makes no
Yes,
sense.
it is, because they have mutual funds with them, and how the funds work. Okay, we'll ask Charles, the communist.
Hey folks, can I chime in on the healthcare system? Can you hear me?
Eric, speak up a little bit. You're kind of low.
Sure. Can I chime in my 2 cents on the healthcare system?
Go ahead. Yeah.
Thank you. I just graduated from a master's in public health, and I would love to hear you critique my take on the healthcare system. And this is not specific to U.S. It's mostly Western medicine. And how I see it, the root cause of the problem of healthcare being really expensive goes back to the number of medical students that get to become a doctor, right? It's almost like an oligopoly, right? There is a limit to the number of medical students who can come in, and then that creates a bottleneck, and then they can charge more and more. But let's say if the government had a plan to increase that size, and I'm sure you're all aware of the shortages of doctors and nurses we have. If the government had a plan to, let's say, double or maybe increase the number of medical students we can get in, then do a residency, right, by even 50%, then in 10 years from now, you have many doctors, the number of patients that they see in cities will go down, then they are going to be more willing to move to the remote areas of the country. So the rural health would improve, right? And then the other solution that can also be incorporated is the use of AI to increase the productivity of doctors. Then believe how much time they spend on documentation, right? If the documentation and the manual tasks are given to AI, doctor can spend more time with their patient and also see more patients. So I'm just curious to get your feedback and see if I'm right or if there's anything I'm missing here.
Yeah, Arya, what you said, it actually is not true. Did you say you just graduated from MPH?
Yes, I did.
Yeah, that's interesting because I know that they, like one of the assignments they give people to do in the classes is to see if this works, but it's a very complex scenario. I don't know if you're in the US or not. It's a very complex scenario in the US, and increasing the number of doctors will not actually lower the cost of healthcare. It's actually it's a very complicated situation. It's not something you can like talk about it in like 5-10 minutes. But one of the reasons of it is cost of education in America.
Well, the cost.
If you go to medical school, if your parents are not paying for your school from the day that you start, like from when you get your diploma, if you're not on grants, from when you start, going to university for your bachelor and all the way till the end of your presidency, by the time you're done, you have at least $300,000 student loans. So increasing number of doctors will not lower the cost of healthcare because